Aloha, my name is Tony and I'm with the Aloha Medical Mission, and it's a pleasure to share this short video of the support that the Chamber of Commerce Hawaii has provided our organization. On behalf of all of the volunteers, staff, and patients, mahalo.
You know, our mission, it's bringing hope and changing the lives of people we serve. And we have done that since this clinic started.
We started out at the first clinic at IHS. When we moved in 2002, we started the clinic at Palama Settlement.
And we were there until this year, June 2020. And we have moved. And you know, in spite of the COVID-19 pandemic and disaster and crisis, the AMM Dental Clinic has been operating nonstop.
It's estimated about 1/3 of adults in Hawaii don't have dental insurance. Aloha Medical Mission has Hawaii's only no-cost dental clinic. In other words, the patients come in, they get their teeth treated, they pay no fee. I think Aloha Medical Mission provides a very, very important service to the community of Hawaii.
Before being incarcerated, I was in a really abusive relationship where he hit me in my face, well, my mouth, and broke my teeth out. The procedure I had done was a partial denture. I have the top and the bottom. I mean, for people like me who can't afford dental, they save lives, they change people's lives. I don't know what I would have done if it weren't for them. I always think back and just remember always hiding myself from the world, and because of them, I'm able to be out there. I have a great job. I love life. I could smile and take pictures. And I would never smile before.
I guess it's changed me because I have a purpose. Finding the monies to run this clinic has been since 1995. And I really feel that people in Hawaii need it. The biggest challenge is finding funds annually to run the free dental clinic.
And the way I look at it is that Aloha Medical Mission would be like a giant wheel. A donor is a very important spoke in our wheel. You're just as important as a doctor, just as important as all the staff members. Be part of our team, and you can have the good feeling that we have, and the fact that we are supporting the people of Hawaii.
Thank you for the Chamber of Commerce for supporting our clubhouse. Yay! Into the club. Yay!
The Boys and Girls Club of Hawaii is back, in person after school for elementary, middle, and high school members.
Come on, guys. Isn't this amazing?
It is our priority to operate safely in the club and continue to provide support for our members.
Hi, I'm Hillary. I am in 7th grade.
Hi, my name's Laura, and I'm in 7th grade.
Hi, I'm Layla. I'm a 7th grader in the Preps division. I feel very safe in the club because I have lots of friends and leaders that help me with everything.
I feel safe because Daddy always reminds us to keep our mask. I feel safe at the club because the staff are always here to help us.
Members have the opportunity to participate in daily programs
Thank you.
related to academic success, good character and citizenship, and healthy lifestyles.
Thank you.
Thank you from the Spalding Boys and Girls Club.
Aloha, I'm Brian Talisian, Executive Director at Mental Health America of Hawaii. On behalf of my team and our Board of Directors, I'd like to extend our deepest gratitude to the Chamber of Commerce Hawaii for its Public Health Fund grant. For almost 80 years, Mental Health America of Hawaii has been fulfilling its mission to promote mental health and wellness through education, advocacy, service, and access to care. We endeavor to reduce the shame and stigma of mental illness, as well as work towards the improvement of the overall care, treatment, and empowerment of those with or at risk for mental health challenges. Through our leadership, we've been expanding mental health awareness, preparedness, understanding, and action since 1942. Through the generous support of the Chamber of Commerce Hawaii, Mental Health America of Hawaii will design and deploy an anti-shame and anti-stigma media campaign which promotes suicide prevention for youth between 12 and 17 years of age. Considering the ongoing pandemic, protests for racial justice, and political unrest over the last year and a half, the need to promote mental resilience and wellness through education, advocacy, and support has never been more critical. In Hawaii, someone dies by suicide every other day. In fact, suicide is the leading cause of fatal injury for people 15 to 29 years of age. A recent report by Mental Health America, which analyzed more than 700,000 online depression screenings from across the country, found that of the Hawaii residents who participated, 41% had indications of suicidal ideation more than half or nearly every day. This same report showed that, based on those residents who took the screening, Hawaii had the highest percentage of individuals reporting suicidal ideation. Because of this, at Mental Health America of Hawaii, we prioritize the elimination of the shame and stigma associated with mental illness in everything we do. Much of the work we do would not be possible without the support of the Chamber of Commerce Hawaii. Thank you for all that you do.
It has been a wild 2 years at HMHB. Our programs withstood the test of times. 6 months into new leadership, the first wave of COVID-19 shook our community. Despite the pandemic, Cribs for Kids set a record number of classes and cribs distributed. Pico Pals thrived within a virtual environment and provided a record number of scholarships. We continued to build talented team members, and we engaged in over 120 volunteers, yet another record for the organization. We took care of the birth worker community, provided them with access to PPE, training such as CPR, NRP, and One Key Question. We engaged a record number of nonprofit and for-profit partners. We grew professionally. 3 team members became board certified in case management, FNP, midwifery, and our team continues to obtain higher levels of education. We have 3 staff members currently enrolled in master's programs and 2 staff members teaching the next generation of midwives, nurses, lactation consultants, doulas, and public health professionals. We pivoted to respond to the needs of the community. We provided an unprecedented number of basic necessities such as meals, diapers, hygiene products, and rental assistance. We provided access to childbirth education, lactation, and doula services to those in need. Our preliminary data from our community-based doula program is more than just promising. It's amazing. The support and the difference we are making in birth outcomes for Hawaii mothers and babies will turn heads. We are finally credentialed and contracted with most health plans. We are a DOH COVID-19 vaccine provider, and our application to become a VFC provider should be approved any minute. We are able to provide laboratory testing in addition to all of the reproductive women's health and perinatal services through our dedicated clinical team. One of our Pico Pals mothers gifted us with an amazing mural in the office. We added new office space upstairs, built a clinical arm and a mobile clinic to go with it that will continue to serve our community in the most needed ways. We have been featured in the press a lot. KITV, KHON, Hawaii News Now, Hawaii Pacific News, Modern Wahine, just to name a few, and made our partners and funders proud. We advocated and stood by women, pregnant, and birthing people. We provided telehealth kits for mothers and with COVID-19, supported military families with deployed spouses and single mothers. When no one else was there, HMHB is there holding space and holding hands so mothers aren't alone. But most importantly, we took time to love and take care of each other, celebrate our wins, grieved our losses, and bonded by eating a lot of great food. Thank you to our funders and board members who stand by us through thick and thin. We look forward to continued growth and serving the community in meaningful ways.